Hello everyone. Welcome to our series on tropical illness in ICU. Approach to a patient with tropical illness in ICU. First step is history of travel to endemic areas. Places visited, like considered geographic variation and endemicity of diseases. Activities done, like swimming in lake or river water, wading through monsoon floods. Food consumed, like exotic foods, uncooked food. Contact with animals, like farm animals and wild animals. History of insect bites, like ticks, fleas, sandfly, mosquito. This book by WHO is an excellent resource on travel-related illness. Next step is to find the interval between exposure and onset of symptoms, that is the incubation period. Here is a table to help on this. We must find out the history for prophylactic measures followed during travel. Firstly, vaccines like typhoid, cholera, yellow fever, meningococcal vaccine. Secondly, chemoprophylaxis like malaria, leptospirosis. Finally is to understand the spectrum of organ involvement, that is the syndromic presentation. It is usually presence of fever associated with A. Thrombocytopenia, coagulation disturbances, hemorrhagic fever. B. Liver involvement. C. Renal syndrome. D. Neurological involvement. E. Rash. F. Pulmonary syndrome. G. Gastrointestinal syndrome. This table helps in deciding the differential diagnosis, in case of various syndromic presentations. Initial laboratory evaluation includes complete blood count to look for leukocytosis or leukopenia, anemia, thrombocytopenia, and eosinophilia. Serum electrolytes, renal and liver function tests, and coagulation profile should be done on admission in all. Initial empiric therapy should include an anti-malarial and one or more antibacterial drugs. Intravenous artesunate is administered in a dose of 2.4 mg per kilogram dose. An injectable third-generation cephalosporin like ceftriaxone, 2 grams IV 12 hourly. Intravenous or oral doxycycline is also an important drug for empiric therapy and is the drug of choice in scrub typhus and other rickettsial infections like spotted fevers and Q fever. Azithromycin may be used instead of doxycycline in children and pregnant women where tetracyclinase are contraindicated. The initial empiric combination of artesunate, ceftriaxone, and doxycycline or azithromycin should be de-escalated as soon as a definitive diagnosis is made and specific anti-infective treatment is continued. Thank you. We will look at specific infections in subsequent videos.